HIPcast is brought to you by Enterprise Social Record.
Well, hey, HIPcast listeners. We are here today with Dawson Ballard, who hails from the great state of Kansas. I had the privilege of going to Kansas a couple of years ago and meeting a lot of the professionals out there. And I'll tell you that knowing Dawson is being sure that you're in the presence of someone who cares about education and who knows stuff. Dawson is a man who knows things, I will tell you. And so today on the show, we're going to, what'd you say, Dawson?
Thank you for that. I appreciate that.
Oh, of course. Absolutely. So today we're going to talk about, in fact, Dawson knows so many things. We're going to talk about his experience with presenting at Beckers just a couple of months ago. And that's really awesome. I love seeing health information professionals get recognized for their leadership and their knowledge in those kinds of conversations and conferences. It's pretty amazing. And so we're going to talk about that experience. We will talk about the future of auditing and coding from a health information professional and a healthcare standpoint. And of course, we're going to ask them all the fun questions that we always ask. So Dawson, thank you. Welcome to HIPcast.
Thank you. Pleasure to be here. Thanks for having me.
Yeah, it's going to be a fun conversation. And a long time ago, we used to read bios. We don't do that anymore because we're more interested in learning about your journey into health information, because it is fascinating to hear people's how they find health information, how they progress through health information. And we often have a lot of students and young professionals that listen to our podcast. So it's good for them to hear kind of how this whole thing happens for people across their career. So let's start there. Tell us how you found it and how you've progressed through your career.
Well, it's kind of a funny story when I tell people my journey. I always start off with this funny backstory about how when I was a kid and I was home from school during the summer, my mom watched General Hospital. And I fell in love with the idea of working in a hospital with all that kind of drama and romance. Now, I know that that was fictionalized, of course, I know, but I didn't know at the time as a kid, but now as an adult, I realized that. And I thought, I really kind of like the healthcare set. And as I got older up through high school and started thinking about what I wanted to do in terms of when I went to college, I was still interested in the healthcare field, but I didn't want to have the contact with the patients. In other words, I didn't want to take the blood and all of that fun stuff. So I thought, certainly there's got to be something else, maybe on the backside, administrative or whatever it may be, that will keep me in the health field, but I don't have to deal with, all of that other stuff. And I discovered HIM. And I had there, where I was living at the time was in Indiana. And there was a school, a college, a career college, right down the road from where I was living that offered a degree in medical billing and coding. It wasn't HIT, it was just medical billing and coding. And I went there to talk to them about that and read through the curriculum and thought, I'm a numbers guy. So I thought, I kind of like this, numbers and assigning codes and reading through the notes. And so I enrolled in the program and just fell in love with it from my very first class. And after graduation, I immediately set for my CPC exam and did not pass it the first time. I was real disappointed. I missed it by 2 points. Yeah. Oh. And then I had to retake it, of course. And then after that, I decided to go for the CCSP through AHIMA. And passed that one on my very first try. So I was very excited about that. And my very first coding job out of college was I went to work for a chiropractor in the town that I lived in there. And I was his sole coder, his sole biller. And I was so green. He was so wonderful to take a chance on me, but I was so green. And trying to learn Medicare rules and Medicaid rules. And I mean, I knew the codes, but, trying to apply Medicare does this, Medicaid won't allow this, commercials won't allow this, and trying to learn all of that as I go. And it was a great experience. And I So from there, I left and I moved on to the billing piece of it in terms of patient accounts. So I went to a therapy provider with PTOT speech and handled not necessarily their coding, that was a part of it, but then I worked on like patient accounts, sending them their monthly statements and taking care of that. From there, I went into the home health realm, and that's a niche within itself.
Wow.
I'm going to stop you right there and ask, was there an ancillary segment that you didn't touch?
Well, after that piece of the home health, I relocated actually, since you all are in Tennessee. I left Indiana and I moved to Nashville, Tennessee. And I worked at the job that brought me down there to Nashville was at, and I don't even know if it's still open anymore, but there was a college there called Remington College. And I taught coding for them for one semester. And then I left there and I went to a place out in Franklin, Tennessee. It was, well, you've all heard of Walgreens, of course. We all know Walgreens. But Walgreens at that time, now they've sold that division of it, but Walgreens at that time operated what they called employer health clinics. So things like, let's say, Disney in Orlando had an acute care, primary care clinic on site for Disney employees and their dependents where they could go instead of going out in the community. So and they had these all across the country, and I became the coding educator for all of that whole division. So I had providers in different specialties all across the country. I did that for 5 years before I wound up out here in Kansas and went to work at a major hospital out here, started an OBGYN in coding, moved into orthopedics, moved into internal medicine, then got into the auditing realm, moved into a couple of payers, Humana and Blue Cross and Blue Shield, doing specifically just risk adjustment auditing. And then after that, I got offered the position I currently have. Living here in Kansas, I work remotely for a hospital out of Chicago. So that's kind of the long-winded spiel of what brought me to where I am today.
It's a great journey. It's fascinating to see somebody that gets to touch on every, like Shannan joked, every ancillary aspect of things, and that's got to build your confidence as you continue forward throughout your career, because you learn at the chiropractor how things work, and then you learn at the next spot how this side of the world works, and as you grow in your career, you start putting all this body of work and body of knowledge together to truly advance.
Yeah, I've got to ask a question. Yeah, this is gonna be a great question. You're gonna love it. You're gonna love this question. When your first coding job was at the chiropractor, did you learn how to manipulate codes?
Ooh.
Very funny. Yes, I did, as a matter of fact.
That's great.
For those non-coder listeners, do you want to explain your joke, Shannan?
For the non-coders, all I mean is a chiropractor manipulates your spine to put you in a better position, right? And to really alleviate pain and all that. So he was chiropractic coding manipulation. Okay. So he wasn't really manipulating codes for higher reimbursement. This is really just a chiropractic, kind of a bad dad joke, maybe. I don't know. I couldn't help it though.
I was going to say, I wasn't expecting the mom on the call to bring the dad joke.
I know. I know, but hey, I did. Pat me on the back. I've accomplished something new today. So Dawson, I love your journey. It's not really the beginning of it, how you found our program and our profession is not unlike most of the people that we have on. They want to be in healthcare. They don't want to touch sick people, or they love numbers and they want to be here. I love the investigatory part of a medical record review and determining and assigning those codes and things. But so it sounds like there are so many things that you could have spoken on at Beckers, but I really want to know, what did you present on at Beckers, and what was that experience like as a health information professional?
I was on two panels, actually. The first one was more of how our organization had worked to make patient access a little bit easier. And so not really, it was kind of HIM related, but it wasn't in a way. But I talked about how we, of course, had streamlined the registration process, streamlined how they can, do all their new paperwork online, calling the patients to we have automated systems that now call the patients to remind them about upcoming appointments, and how my particular hospital had created an actual app to help the patients navigate through the hospital. It works kind of like Google Maps for the hospital. So if they have an appointment, say with the outpatient radiology, they can activate the app and it will tell them step by step, okay, you're at the front desk, step by step, where to go within the hospital. So I talked about that piece of it. And then the second one that I talked about was kind of on the same level, but how you need to get physician buy-in, and in terms of a new technology that you're wanting to bring into the hospital, and how to ensure that what you're looking at can actually solve the problem that you're wanting it to. Like, if it's to decrease the readmission rates of your diabetic patients, can it really and truly do that? And how to use that data to, test that and measure that, and how to get the physician buy-in and get the buy-in from the higher echelons as well, that, hey, this is needed, and how to present your case. So it was a wonderful, wonderful, wonderful experience. It's actually the second time I've done it. I did one before last June when they had a behavioral health. They just had a behavioral health conference, and I spoke on one there as well about the future of behavioral health, especially with telemedicine and the possibility that telemedicine was going to expire, which of course it did, and what behavioral health professionals need to do to prepare for that. Since everything from Medicare now gone back to pre-COVID, and with behavioral health, they have to be seen in person at least once a year, and how to start preparing your facility or hospital or whatever it may be for that, and how to take that, plan out what your next steps need to be for that. So it was a great experience. I loved it.
Yeah, physicians and patients alike have to prepare for that, right? Because especially with behavioral health, sometimes those are very sensitive things, and doing that via telehealth is a lot easier to do for some folks. And so now they're going, to continue care, they will have to leave their home. They will have to go into a practice. And sometimes those practices are only behavioral health providers, and maybe there's still some of that stigma tied to that. And so that makes it a little nervous. I'm curious about the technology. You talked about the technology panel you discussed before. What kind of technology, what kind of experience do you have with getting physician buy-in, and how did you do it? And what kind of key takeaways could we apply from an AI perspective, leveraging AI in the future?
Well, we identified, number one, that we had these particular, I don't want to call them problems, but let's say particular issues that we had to solve. And the only way that it wasn't being handled internally the way that it should be. Not that there was, incompetent people. It was just too big to control, if you will. So we knew that the technology out there existed, and there's tons of it. There's several different vendors. I don't know if you've ever gone through that process, but there's several different vendors who all promise the same thing. And so we did kind of a presentation to our high-level physicians, high-level executives about, we can't control this internally. We need to take this outside, or bring an outside somebody in that can help us get this a little bit more manageable. And so we kind of went through the data about what the problem specifically was, what kind of technology exists, and what they can do, and what the benefit of that would be in terms of, getting it in there to help control that a little bit more. There were lots of questions that the physicians had, obviously. Some we could answer, some we could not. And then we kind of got them on board that, yeah, we agree, this is definitely needed. And then we continued to involve them going forward in the conversations when we brought our particular vendors in to do demos or, whatever it may be. We had the physicians there so they could ask those specific clinical questions that maybe the HIM professional didn't think of. So we could have the whole piece of it. So, you have to identify that there's the issue, look at what technology is out there that can solve that problem. And then you have to show to the physicians or higher executives, this is something we need to help get this under control or manage it in whatever way it is, and allow them the process to see how it's going to work so they can see the benefit for themselves. That's kind of how we approach it. I know that sounds kind of basic, but that's kind of how we approach it.
I think it's good for people to hear just how the process works and how you walk through it. And I think I'm going to ask a two-part question because I'm fascinated by the wayfinding app. That's something that I've talked to several health systems about, is being able to move patients through a facility because they're all painted the same color and you get lost in there pretty quickly. So one of the things I've thought about in the past is connecting let's take Epic as an example, connecting the MyChart app to wayfinding. And then as soon as a patient comes on campus, you use that phone as a geolocator to say, all right, I know this is an ortho patient or a cardio patient. I'm going to direct them even outside of the facility to the parking spots that I want them to be in that are reserved for their specialty. And then once they get into the hospital, how do you do all those things? It's probably not as deep as what you guys went through because it sounds like you did the wayfinding on the inside. So is there a connection to your EMR's app and the patient visit, or is it a separate app from the EMR?
To my understanding, it's just a separate app from the EMR. We never thought about connecting it to Epic. I didn't even know we could even do that, to be honest. So I appreciate that piece of it. But it's just a separate app that they can just activate within the hospital. And we're a 3 hospital system, so it works at any one of our hospitals. And they can just punch in, where they're going, the specific physician or, radiology labs, even the cafeteria if they needed to. And it would tell them exactly how to get there from their location. So it's been wonderful because, we all know patients have trouble finding their way through the hospital, even though they've been there 100 times, right? I mean, it happens. Yeah. So it's really been wonderful. We kind of had a little trouble getting patients to download the app. So we kind of had to do a little marketing piece around that specifically to our patient population, but it's just gone gangbusters for us.
Yeah. I think it's a great idea. It's a great service to the patients because you're right. Even though they've been in there 100 times, it's still hard to navigate the place. And it's hard for folks that are in hospitals every day to navigate hospitals. And I think I'd probably have the cafeteria as one of my favorites in my wayfinding app as well. But my second part question for that was back on Beckers, because I've been a follower of Beckers for a long time. They put out some really great newsletters daily for different things. I follow the IT side. I've also followed the revenue cycle side a little bit just to try to keep in touch with what's going on there. But I've never been to one of their conferences. It seems like their conferences are starting to really grow in popularity. I know 2 THIMA members that spoke there as well at this last conference, and they're some of our top folks in our state that were there speaking. So just for my curiosity, how was the just general conference that you were there from an education perspective? Was there a vendor hall, or is it just all education? I'm just curious what it was like.
There was actually an exhibit hall. It was kind of similar to an AHIMA conference. If you've ever gone to an AHIMA or an AAPC conference, they have it divided. Usually it's in the same location in Chicago every year, same hotel, same location, everything. So they have the top part of it is where you're broke out into your individual sessions, and each one runs about 45 minutes. And it's either a presenter or it's a panel of usually 4 or 5 individuals speaking on a particular topic. And then when you go down the escalators, it's an open exhibit hall. And I mean, obviously it's going to depend upon the theme of the conference, what exhibitors are there. So when I was there for behavioral health, it was just all behavioral health, behavioral health AI, behavioral health, EMR kind of thing. And then they have several throughout the year. The one that I spoke at this last time was the revenue cycle health IT, which is a big one. It lasts all week, and there were probably 200 and some odd exhibitors there. And all rev cycle. It's rev cycle and healthcare IT. So there were a lot of other vendors there that were promoting their, surgical robots that actually had the robot set up in the foyer where you could actually see how it worked. And a lot of the AI were there, rev cycle, software systems and things that you were able to go in and get different demos. So yeah, it's a great experience. It's always in Chicago. It's always at the same place. They have several a year that are more focused on different subjects. So they have behavioral health. They have the IT one. They're getting ready to have one, I think, next week that is just specifically for CEOs, CFOs. They have one just for ambulatory surgery. They have a payer one that's coming up where it's just a couple of days, but all of the presentations and all the panel discussions are from some of the big wigs at some of the major payers on what they're doing to improve claims or, claims processing and things like that. So yeah, it's a great experience. I recommend anybody to go to.
So it's something that it's definitely a conference that I want to put on the radar for the future for me, and to figure out how to get there, because I think it's a great. I like how they split it up by specialties in some ways, and they do different offerings throughout the entire the year. It's definitely a place or an event that's on my radar going forward to get there. But so to shift back to the just general coding and auditing, I mean, out of curiosity, what's the future of coding and auditing from your perspective?
Well, AI, of course, everybody's talking about AI, and I don't think I could answer that question without mentioning AI, whether that's computer-assisted coding or actual AI taking over the coding piece. I get this all the time. People think, oh, AI is coming, AI is coming. AI is here. It's not coming, it's here. And you need to be prepared for that. And again, whether that's from the whole revenue cycle perspective, where AI can help you with eligibility all the way to denials, or just the coding piece of it. And one of the things that I had talked about Beckers before in a podcast that I did are things you can do when you're looking for an AI coding vendor specifically to come in, and questions you need to ask. So, you know what you're dealing with, to make sure they know that they have the healthcare experience, that, the vendors are the ones that know what coding is and how important that plays into the rev cycle process. You have to look at your privacy and security. What are they doing to protect your data? And then also keep the human touch piece of it. You know what I mean? Don't just have the AI come in and fire all your coders. It's not perfect. So you still need to have the human touch. But AI definitely is the future of where coding and revenue cycle in general is going. And I think it's also going to eventually at some point work its way into even ROI. And it may, I'm not in the ROI realm piece of that, obviously, so it may already be there, but I believe that eventually AI will take over some of the ROI functions. So definitely AI is the future, I think, of where entire rev cycle coding and billing is definitely going. Another thing I would mention is, and I know we don't have a definitive date yet, but ICD 11 is coming at some point. I have no idea when CMS is finally going to decide they're going to implement that. But I know that ICD 11 is coming, and I think you need to start looking at that and at least playing around with that so you have an idea of what the code set looks like. You don't necessarily have to start your implementation at the moment, but have a general idea of what it's going to look like. So when CMS finally says it's coming, you know what to expect, so we don't have the problems that we had when we went from I-9 to I-10, because I had a lot of horror stories around that. The people just were not prepared for that implementation. So, so that would be the two biggest things I think is definitely on the radar for the future.
So I wonder if people will still completely miss the preparation side of going from 10 to 11, just because it's, that was a painful process going from 9 to 10. I remember, it was supposed to happen fairly quickly. It didn't happen fairly quickly. It ended up stretching out over the course of a few years. But, we have a short attention span as humans these days. Yeah. and I think a lot of people have either retired, are going to retire, or have forgotten the pain and suffering that a lot of people went through from going from 9 to 10 and then going from 10 to 11. And I'm not in coding, so that's beyond my brain. But I mean, it's another massive expansion in the code sets and the process and whatnot. So I just predict that that's going to be a mail of a hess, as some people would say, to make it PG.
Yeah.
But it's something that's got to be done, right? And maybe AI can help with that. Maybe that's the convergence of the technology and the change, is that AI can actually help us through that transition. And it sounds like you mentioned AI, and I agree with you. AI is here. It's something that we should be using every day. And I would ask your opinion on, a lot of folks, we tell them it's here, it's a tool, it's not a replacement. And it seems like that's what you're seeing as well in the marketplace. Is that a fair assessment?
It's a fair assessment, absolutely. Although I have seen some situations to where they've implemented AI in the coding and they use it 100% and they fired the whole coding team. I have seen that. So,
wow.
Yeah.
Did they do it successfully? We had a guest on recently that was talking about hallucinations and different things like that within the AI that was evaluating things wrong. And that's a bit scary for me to think about, because it's like, imagine if you're doing so. Well, I mean, I'll tell you, I just saw a demo of a product yesterday that was doing AI summaries of medical documentation, and I'm inside going, but what if it gets it wrong?
Yeah.
What if a clinical decision is made off that summary and and it pulled the wrong figure? It turns something around, or that's a little bit scary to me to put this technology in at this point as a replacement versus just a tool set.
Exactly.
Mm-hmm. Yeah,
Shannan, we got you back here. What do you think?
Yeah, no, I'm having technical difficulties over here. I blame Mississippi because that's where I am today. But I blame their internet. Not my anything. But it's interesting because it is a tool. It is here. We are using it. In fact, we've been using it way longer than this AI craze has been happening. We just haven't been regulating it, right? And so now we've got to consider, okay, now we have to hold our vendors accountable. And so, Dawson, back to something you said earlier when you were talking about, does this do what it's supposed to? Is it protecting my privacy and security? Is it making my data at rest or in motion, higher risk, or, any of those things? Something that we don't talk about a lot that I think we're missing is in that vendor discussion. I think we have to include in the data use agreement component that they're sharing when they change those algorithms. They're sharing when they review them. They're sharing any drift that they find. They're sharing if they found a problem, are they going back to look, and are they letting you know as a hospital or a physician that they got it wrong and somebody needs to review the chart. And then from a contract perspective, are you going to have the vendor be responsible for paying for that review? Or are you going to take that? Because if you were documenting it yourself, the vendor wouldn't take the responsibility, right? They would not spend their time and resources to review that because you're documenting yourself. But if you're using their tools, are you going to hold them responsible to do documentation? So there's a lot of contract considerations there as well.
Yeah, it's going to be complex in the future. So, well, this was a fun conversation, Dawson. I appreciate you joining us from Kansas, the flatlands of Kansas. We're in the rolling hills of Tennessee. So it's been a pleasure having you on today.
Thank you. Well, again, appreciate it. I love to talk about the profession. So I appreciate very much you taking the time to have me here. It's been a great conversation.
Absolutely.
Yeah,
well, it's good for the listeners to hear the journeys of so many people, and health information is such a great career path for so many. So thank you for sharing that. And Shannan, until next time, my friend.
I'll see you next time, buddy.